Hello everyone. Hope you are fine, healthy, and trying to escape from Corona. I was busy this entire week. I was having back to back surgery, so I couldn't manage time to make a video. I thought I'll quickly make a video and put it. First thing is, recently someone asked, you're unable to get that interest when you are in BDS. You expect you to get yourself into MBBS, then you don't get it. You get into BDS, and bad experience, not getting enough marks, or some senior behaved rudely, or staff not treating you properly, or that subject is just not entering into your brain. Some subjects you just don't like them, something of that sort. So this leads to that a small fraction of disinterest, and then you keep accumulating that disinterest, and it becomes complete disconnection from that subject or that entire dentistry. So what I thought is, I will quickly give you some points so that you can fall back on them and think before you decide whether it is not interest on the subject, or is it just your laziness. I am being very frank and rude to you. Suppose you think that you are not interested, or you are not finding that rhythm in the field what you are. Anything, it can be dentistry, it can be anything. These are the basic things you should ask yourself in your mind. First is it really the interest that matters, or is it your laziness? That's very, very important, because people think I would have done better in something else when they are working in this. This is the fact. You see, you will be thinking about that job or that work or something else which is not there now in your hands, and you think I would have done that beautifully well. Suppose you see some anchor in TV, you would be thinking I can also become an anchor. Suppose you see someone singing in these college fests and all, you think even I can sing, but I'm not interested because I don't want to get exposed. That's the first thing you should identify. Is it your disinterest, or is it just laziness? Suppose you really feel it's disinterest, you're unable to get that interest in dentistry. Then, next immediate step is, you have to identify what is your interest. Everyone can have multiple interests. Now I can think, I have interest in politics, so I should get into politics. Or, I want to become an IAS officer, I can get into IAS, civils, like that. So, you may have many varied interests. But, very, very important point is your interest in other fields the reason for your disinterest in this field? Very, very important for you to identify it, locate it. People think just because they did not get into MBBS, or their friend is earning much better than those who are earning in dentistry, if those are the reasons for you to have disinterest in dentistry, then you are in a wrong track altogether. You will never go anywhere with that sort of interest. Suppose from within heart you feel I am not fit for this, I am born to do something else, and you identify what you are born to do. Suppose you wanted to become a cardiologist, suppose you wanted to become something else, and you really are passionate about it, and you can go sleepless, you can go without any food for doing that job, doing that work, then I think that's your interest. Then you should go about working on it. But if your interest is just based on someone else's opinion, someone else's ideas, I think that's a blunder what you're doing. You are missing a bird which is worth in your hand. You're worried about the birds which are there in the bush. So my intention is to just highlight that point. You will never have a born interest in anything. You have to develop that interest, and once you get that chance, you have to cultivate it. You have to keep working towards it. When you turn back and see after 10 years, you should have some story to tell about yourself, some history to talk about yourself. It becomes good history if you you fought with yourself and became something great in your field. So you should first isolate that thought and give it some time. That is, suppose you are disinterested in dentistry, identify what you are interested in, work on it for 1 month, take a break. Nothing is going to fall on your head. If you take a break, give 6 months break for dentistry, let that year go, but you take a break, do something else what you're interested in, and if you still feel that you are unable to cope up in that field, then you come back and pursue this. But if you keep that thing in mind and work, you will neither be good in this nor in that. So I want you to understand this. I want you to think about this. So once you sort out this, once you understand that this is not a distraction caused by someone else's words, or this is not because of something else you lost, and you really come to terms with it that you are doing dentistry forever and this is going to give you food, so you want to pursue this, then comes the next step. That is, once you realize that you are in dentistry, sometimes even though you try, you don't get interest in that subject no matter what, how many stories I tell, how many things I tell. So there are techniques to develop interest, or there are techniques to focus on what you are doing. Let it be more mechanical, no issues. Do not think that everything what people do is what they like. Life is never like that. You see, there are so many situations you have to face in life where which you don't like it, but you have to do it. It is not always rosy as you think, that you expect something and it happens to you. No, life keeps on throwing at you all those things which you don't really want. So you should take these 5 years as a learning experience, that whatever comes to you, you have to start liking it and develop interest in it. So I'm going to tell you a few techniques. If you are really interested to develop such interest or concentration on what you are doing, then I think my tips will help you a lot. First, very important thing is, suppose you wanted to develop interest in the subject I'm telling you, otherwise till here you can stop the video and do whatever you want to do. But if you really want to develop that interest, this point I want you to focus on. First thing is, whatever you are doing, make it interesting for you. You keep postponing your studies till the last day of your examination, and then you feel you're not getting interest. So develop interest in that, and daily at least 5 minutes, 10 minutes, 15 minutes, you, based on the subject you want to focus, 15 minutes you allot it for it. Read some related articles, or get some clinical exposure about it, or go into the field and see what exactly that department does. So if you can do this study, or allot 15-20 minutes on working about the what future prospects, or how other people learn, or how your seniors take that subject. So all this, if you can allot 15 minutes for learning, it is not about just reading that subject, just some kind of learning related to that subject, that will add to your strength a lot. That will slowly develop that interest. Second important thing is, stay away from those diseased people who keep training your brain, saying this subject is bad, this is boring, this is bad. So keep away from them. They are disease, and that disease is contagious. So stay away from such fools. I don't want to say, but they're idiots. We should stay away from such people who spread that negativity. They don't like it. They don't want anyone else to like it. So stay away from such people. That's very, 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 very important. Then always divide your study time. Suppose you are reading a chapter. Divide into 4 or 6 slots, 6 segments. For example, I'm telling you, suppose you are reading a topic and there are definition, clinical features, there are radiological features, histological features, then the diagnostic aspect, and then the treatment part. Suppose if that is the segment, divide into 6 segments and read them at different locations. Brain store them in different locations. So you suppose you want to read all the diagnostic or the introduction or the definition, whatever, you allot a room for it. Sit there and read. Sit in your balcony and read, or sit in your bedroom and read. So allot it some spatial slots. That way it sits in your brain easily and you will remember it for a long time. And I don't know if you are Hindu, Muslim, Christian, or whatever religion you follow, it doesn't matter to me, but few things really human body has this connection. Suppose you wanted to develop that interest, or suppose you wanted to grasp things whatever you are reading, try this technique. Just starting anything, before starting anything, reading or your session, breathe. Bruce Lee breathes and jumps and kick a wall, the wall will break. If you jump and kick a wall, your leg will break. That's just because of his breathing. You see his videos, you will know how breathing can help. He makes different sounds with his breathing. That's because breathing has that power. So suppose you are unable to get that interest, breathe. Breathe in more, take in more air and slowly release it. That will definitely help you. So suppose you feel stuck or you are unable to move ahead from that page, take a break and start breathing deep and relaxed. If that doesn't help, whatever you are reading, put your tip of your tongue to the palate. If you can read with that posture, the tip of the tongue to the palate and read. You need not do like this, but tip of the tongue to the palate is a very good technique to get connected to your brain easily. And that sounds silly, but really I'm telling you this works. Suppose you are reading 100% matter, 40% will get retained into your brain. And the other very, very important thing is posture. See how you are sitting, how you are reading. You're reading, sleeping on the bed, or you keep your neck tilted. Your spine should be erect. Whenever you are reading, keep your spine erect. And give only 15-minute sessions. Whenever you are reading, give 15-minute sessions only. Not more than that. 2 hours read, 15 minutes break. No. Only read 15 minutes. That will help you a lot. And you will really come back and say, sir, this has worked out very well. 15-minute slots only for any topic. Any topic. And if you realize, in your exam also, you will not get more than 15-20 minutes to write any question, any answer. So 15-minute slots only. The next very important step is every topic in dentistry, not only dentistry, in any subject, in any engineering, medical, anywhere, you will have hardly 15 important points about that. Rest all is all cooked up stories. Every topic you take, there are only 15 important points. Rest all is masala. So if you can remember 15, suppose you take any topic like ankylosis or your indices or biostatistics, whatever, every topic will have 15 points. So once you read those 15 points, close your eyes and start revising them. Whenever, suppose you are driving, you're going home, revise. Suppose you're watching TV and there's an ad break, you think and revise what all 15 points I have read today. That's it. This is going to do wonders, miracles, I'm telling you. That way you will get out of some dry subjects where you cannot really develop interest in them. And for any given subject, for any given field, everything you cannot like or you cannot love everything. There are some areas which are dry, you have to struggle with it. Even not me, everyone will agree with this. Not everyone will like all the fields whatever they are doing. All right, there are some dry areas, and to make it a complete circle you have to keep rolling with those dry areas also. Even government know this. That's why they have put 50% as pass mark. 50% no one can retain. 50% no one will remember also. Such a vast subject. So my intention of making this video is to make you understand that there are areas which are not interesting, which are dull, dry. Just to fight those few areas which are not interesting, you cannot leave the entire field. So start developing that interest. And after everything, you should keep reminding yourself, this is your food. This is your life. If you don't develop that interest, if you don't like it, you will never be able to be happy in your entire life. Suppose you get some life partner who is not what you expected, you feel bad. You cannot keep on crying all through your life. So there are some adjustments everywhere. There are adjustments. You ask the best of the best people in MBBS also, they have some regrets. They will say, I should have got in that college, or I should have got it in this area. And those who are in cream colleges, they say, this is hectic. Unnecessarily I have taken this, unnecessarily I have selected this field. So there are regrets in every field. There are dry areas in every field. Do not get stuck up in that dry area and spoil your life. You should cultivate that happiness. You should keep on reviving that interest and work towards it. I'm telling you to do all this. Add a purpose to your life. Add a purpose. By doing this, you're going to earn money, and that money you're going to invest in something, some betterment for public, or some old age home, some orphanage, some animal welfare, whatever. So add purpose to your life. Then whatever you do, you will do it with ultimate interest. Hope this helps you. And if you still have any doubts, I'm always there. Please put it in the comment section. I will really try hard to make some video and help you. Thank you so much for listening, and hope I have been of little help for you. Thank you.